to Studio DOHC podcast. My name is Melissa Diaz. I'm the marketing manager with Desert Oasis Healthcare. And today I'm excited to bring you three very special guests to our studio. Local Medicare experts, Jeremy Proctor with Bill Proctor Insurance, Marv Law with HealthBridge Insurance Solutions, and Brian Bilhartz with Bilhartz Desert Insurance. So we can do a deep dive into Medicare and talk about what we do every day for our members and the people that live in the Coachella Valley. So welcome, gentlemen. Thank you for joining
Thank you,
me.
Melissa.
I really appreciate it. We're going to kind of do, I guess, an overview. We're going to really go a little bit deeper into Medicare, but let's go ahead and get started with just the basic parts. Jeremy, if I could start with you, if you just want to kind of go over the different parts of Medicare.
Sure. Part A is basically inpatient, anything that happens inside the hospital. Part B is mostly outpatient, that will cover doctor's visits, lab work,
Mm-hmm.
physical therapy, that type of thing. And then prescription drug plans, which is Part D, which covers your medication.
Okay, great. Thank you. So, Marv, when people talk about Part C, so that's technically, is that a part of Medicare or how would you classify Part C?
It is a part of
Mm-hmm.
Medicare, but it's like an inclusive
Mm-hmm.
part. It takes A and B and D, almost always D,
Mm-hmm.
and it puts them in one Medicare plan, health plan. So it is a part,
Mm-hmm.
but it's all in one, or they sometimes refer to it as a bundled health plan.
Or C for
Part C,
combined,
yeah.
right?
Yep.
See, I've worked for Desert Oasis for close to 15 years now, so you can't help but absorb some of this information. And I find it very helpful, that I can have um, you guys to rely on to answer these questions because there's just so much information that changes from day to day. And then people have very specific situations. Not every situation is the same. And, so I want to say thank you so much because I really do rely on you to help take care of our members at Desert Oasis. So here at Desert Oasis Healthcare, we do Part C, or Medicare Advantage. We strictly do HMO Medicare Advantage. So if we could, I wanted to talk about what I think about a lot of the questions that I get on the phone every day, and the biggest question I get is, when do I have to sign up for Medicare?
Yeah, so typically you become eligible for Medicare when you turn
Mm-hmm.
65. So if you are collecting Social Security, your Medicare card will be mailed to you automatically about 3 months before you turn
Oh,
65. But if you're not collecting Social Security yet, you can either go online and apply for your
mm-hmm.
Medicare benefits, or you can go into the local Medicare office in Palm Springs or Indio
Mm-hmm.
to be able to sign up for your Medicare benefits.
Okay.
And then there's going to be cases where people are eligible prior to age 65
Mm-hmm.
due to disability. You can have a specific diagnosis that gives you eligibility, or if you've been collecting SSDI payments for over 2 years, that 25th month, you could become eligible for
Oh, okay.
Medicare as well.
So if you've been collecting SSDI for over 2 years, then you automatically become eligible for Medicare.
Yeah, that's correct.
Okay. Oh, awesome.
You're also auto-enrolled into Medicare
Okay.
A and B at that time.
After
Right.
your
And if,
22nd
yeah.
month, is that what
25th, yeah.
25th month?
So if you're not automatically enrolled
Mm-hmm.
through SSDI or Social Security, then 3 months prior to your birth month,
Mm-hmm.
you can enroll through the Social Security office
Okay.
or online through the Social Security website.
And would you recommend that anyone do it sooner than that 3 months? Because I know that sometimes people are they're very itchy to start their Medicare, which I can't blame them.
I'm itchy to
Yeah, me
start my
too.
Medicare.
So, is there really any benefit from trying to do that before you're?
You really can't.
Yeah, okay.
Yeah, they
That's
won't really allow it.
the beginning of the open enrollment for Medicare itself.
Uh-huh.
The initial open enrollment is 3 months before your birth month,
Okay.
your birth month, and then you still have 3 months after
After.
that to enroll.
And then if you don't do it, then you can possibly run the risk of becoming penalized for not
Right.
signing up.
There's for a late enrollment penalty. It's an exception if you're actively employed and on a group health plan. Then when you transition to Medicare at any time in the future, as long as you're actively employed,
Mm-hmm.
there's some forms to use, and they can waive that penalty, and you
Okay.
can transition. Little different process,
Uh-huh.
but you can do that.
Okay.
Mhm.
So Jeremy, I have a question. When someone comes to you and says, I'm turning 65, I'm still working, um, should I sign up for my Medicare, or should I keep my insurance through my employer? What would you
That's
recommend?
Yeah, that's a good question. Generally, you would sit down with them and kind of analyze both options.
Mhm.
Some employers, the employee's not paying anything for their coverage, which that's great.
Yeah.
But then there's other employers that maybe they're paying three, four, $600 a month in premium that they could go over to Medicare, pay the Part B premium, which is currently the 164.90,
Mhm.
and have zero copays on almost anything.
Yeah.
So you really just have to analyze what's going to be best for the client, and also a lot of times will be the prescription drugs.
Uh,
Um, that if they're on some very expensive drugs that they're going to hit the donut hole coverage gap,
mhm.
it may benefit them to stay on the employer plan, even if it's costing them more money, because then they're going to
Because the
have much
drugs are
lower
gonna
copays.
okay. Well, that's why it's so important for people to make sure they seek out the services of a local, insurance agent.
Yes.
In my opinion, working with you guys for as long as I have, and I've seen, really, really terrible scenarios where people have called those 800 numbers, or, even, some of the mailings they get, and then they end up on a plan, and then we're talking, right?
Yep.
then
Having to fix the problems.
then they get stuck with a plan where they have a lot of difficulties or problems. Um, can you give me any other, I know there's plenty of benefits with working with an agent, but how about if you tell me some of the reasons why you think it's important that people work with a local agent?
I think working with someone that's local, especially here in the Coachella Valley, one of the biggest things that I've, tried to do and work with my agency is to have our agents homegrown, because we know, the agents that don't live here on a full-time basis, that aren't here year round, they're not coming out here and purchasing homes and purchasing cars. Like, it's good for the economy.
Mm-hmm.
And I know that the mayor of every city is going to love to hear that message, because it is important that we keep our economy local.
Mm-hmm.
But beyond that, uh, we all get phone calls from our clients all the time. Hey, I got this letter in the mail and I don't know
Mm-hmm.
what it is. I don't know what it says, if it's telling me I should do something. So, okay, when can we stop by? When can we come and, take a look at this
Mm-hmm.
letter and explain that to you? It's not part of the enrollment process. It's not something that, we get compensated for, but we do it because we care. We want to let them know that we're their partner in this healthcare on the insurance side of it, where Desert Oasis is their partner on the healthcare side of it,
Mm-hmm.
Hmm.
and that, we're here for the long haul.
Yeah.
We don't just want to come and go.
Mm-hmm.
We're really focused on building relationships with our clients and with their family members or whoever's involved in helping them with their healthcare decisions.
So that's super important, because we have Medicare open enrollment coming up, and we see a lot of people coming into town just for the open enrollment period, right? So Medicare open enrollment, October 15th through December 7th, that's the time that you can, look at the different health plans and make a decision, make a change, obviously seek the services. But what about after open enrollment, Marv? What kind of services do you provide for clients after open enrollment?
Generally, when we sit down and do an enrollment, no matter how efficient or careful we are to explain
Mm-hmm.
benefits, people forget 95% of it.
Unfortunately,
It's a
they
lot.
do.
So
It's a lot,
it's
it's
a
a
lot
lot.
of
Yeah.
information, and they just know we're taking care of them, so they know they can call us. They can't call a 1-800 number, or they
Mhm.
can't often they can't reach an agent that comes into the
Mhm.
desert during the annual enrollment period. So
Mhm.
all year long, we're answering questions about their prescription coverage. Why has something changed? Or they may say, hey, my doctor's recommended this prescription. What's
Mhm.
that going to cost me on
Yeah.
my plan, right?
And it's smart that they even ask that, right?
Well,
Hmm.
sure,
Yeah,
sure.
ahead of time.
And they can know before they fill that prescription
Mhm.
often and say, well, maybe there's another, you can go back to your doctor, maybe
Mhm.
there's another prescription that will be just as efficient, just as effective, but maybe won't cost you quite so much. So we answer a lot of questions. Maybe their doctor retires.
Yep.
Sometimes that happens, or
Mhm.
their doctor
Mhm.
moves, and then they want some advice on that, or
Mhm.
maybe a specialist. And that's where Desert Oasis helps a lot, because Desert Oasis will help coordinate and help them navigate
Mhm.
through the doctors and the specialists,
So,
and you're
Sorry, go ahead.
Desert is super good at informing us as local brokers
Uh-huh.
what doctors are new. Doctors don't leave very often, but occasionally it
Mm-hmm.
happens. So we get a heads up on that.
Mm-hmm.
Somebody outside the area don't
Doesn't.
get all your
Yes, you're
updates,
Yeah.
absolutely
right?
right. You're right.
And so they're enrolling somebody that may show up
Mm-hmm.
on a carrier site. They may not even be here anymore.
Exactly.
And then
Because we
yeah,
know how those carriers keep those
Those
websites up to
online,
date,
yep, they're
right?
sure,
terrible.
exactly.
So I would almost see that as an extension of the patient's care team. Desert Oasis really has a huge care team behind them. On top of your primary care doctor, we have all types of providers behind the scenes that are helping staff that are helping the patients and the doctors. But you guys also do the same thing, and that's what I love about our relationship and having a close relationship with the local agents is that, you can come to me if you have anything or if you need anything, and I can come to you
Yeah.
if I have questions or anything. So that's, really a great reason why someone should pick someone local, I think. So let's talk about the soliciting that people on Medicare get from, let's start with a telephone. What would you say, like, let's say, what would you say to your mother if she got a phone call from someone that was trying to sell her Medicare over the telephone?
I would say if you get a random call like that, just let them know that you're not interested or I'm already working with a local agent, um, because you should never be giving out that personal information
Hmm.
unless you've asked that person to reach out to you.
So people should not be calling Medicare recipients on the phone. Is that an accurate
That's
statement,
very
Marv?
accurate.
Okay.
It's
Uh-huh.
non-compliant. It's against Medicare rules.
Hmm.
I just think Medicare doesn't have the capacity to enforce that.
Okay.
And they can get, members can get on a do not call list, a
Hmm.
registry list, but sometimes that doesn't help either.
Yeah.
And so the best advice is to either hang up. You
Hmm.
don't have to
Yes.
tell them a thing.
Hmm.
Just hang up. I got a local agent
Mhm.
that I'm working with who takes care of me.
Hmm.
The other option is I would say ask them, what's your license number,
Ah, okay.
right?
Uh-huh.
What's your name?
Hmm.
And they hang up. It's
Yes.
amazing.
Yeah. Is it crazy how
Yeah,
that
it's
works,
great.
right?
Yep.
Oh,
No, that's a good one, asking for their license
yeah,
number.
that
Yeah.
is.
You
That
know,
is.
that
Um,
definitely scares them away.
I think that sometimes when, well, number one, sometimes people are lonely and it's someone to
True.
talk to on the phone, and they tend to employ people that are very good at talking to senior citizens. But then the second thing they do is they dangle these, carrots in front of them. They tell them all these wonderful things that they can get with this plan, right?
Right.
But they're not, you know, giving them solid advice.
You know, where there's a give, there's a take.
Mm-hmm.
I mean, if they're going to be giving you this rebate money back, they're taking it from another benefit.
Mhm.
And these people over the phone, their focus is just to make a sale. They're not there to really find the right fit for this individual with their medications, with their doctors. And we all have unlimited stories of situations where
Absolutely.
we've had our clients or people that have been referred to us that said, oh my gosh, I called, they didn't explain anything to me, I didn't understand anything when we were finished. And fortunately for us, we're there to clean up. We're the cleanup crew, and
Yep.
we're okay with that.
Mm-hmm.
It's unfortunate that, people have to go through those situations in the first place. But, hopefully through this podcast and, who we all are and what we're doing here on a local basis, we're hoping to kind of head that off,
Yeah.
that
Yeah.
people don't fall into those traps of what they see on TV, the phone calls, the mailers. I mean, stacks of flyers and mailers and
Well,
and
Mm-hmm.
they
Well, I
get
mean,
in the
that's what I
mail.
tell my clients every year is bring in that stack of flyers you have. We can talk about every single one of those options.
That's right.
I can tell you the pluses, I can tell you the minuses, and compare what's going to be best for your
And
situation.
give you an honest opinion.
Yeah.
Yeah.
Not.
And I mean, even between a husband and wife, husband and husband, some people think, oh, we have to be on the same plan.
No.
That's not true.
Mm-mm.
Like, one plan with a specific carrier is best for you. Based off your drugs with another carrier, that one's going to be best for the partner.
Yep.
Yep. So one of the things that I've been hearing about lately is that costs are going up on everything, right? But people that are on a supplement and a Part D plan, I've heard that those premiums are going to be going up quite substantially this year. Can you speak to any of that, Brian?
Yeah, people are starting to get their annual notice of change. And, there's a lot of new regulations that are affecting Part D that are going to be changing over the next couple of years, including when people reach the catastrophic period, they're no longer going to have any out-of-pocket costs. And all that's great news for the individuals that are impacted and affected by that. But in the more general sense, it's going to kind of lead to an increase in premiums, and we're starting to see it. We're seeing premiums more than doubling for standalone Part D prescription drug plans in some cases. And one of the things at this point that we don't have enough information on is what is that going to do to the formulary as well? The list of drugs that each plan covers is different, and there may be a reduction in some of the more expensive medications. So it's really important that Medicare beneficiaries, especially for people on a standalone Part D, because they're limited to that December 7th cutoff date. If you have a standalone Part D plan, your last opportunity to make a change to that plan is December 7th.
Okay, good information.
And you don't really realize that your plan's formulary has changed until January 1st. You go to the pharmacy.
When you go to get a refill, yeah.
You get that big giant book. It gets tossed on your table, and you forget to read it.
Yeah, exactly.
And
use it as a
that's
doorstop.
always something that you should take a look at. The first several pages is going to tell you the big core changes in your plan, but then there's always little stuff that changes as well.
Okay.
And that's where you can reach out to us as local agents. We can look at that specific plan and say, okay, this is what's changing in your situation. There might be a better alternative for you.
And those booklets they get don't always address their specific medications.
Oh, yeah.
So like Brian says, it's very important to do a regular review, an annual review, especially because of drug coverage.
Yeah.
Make sure that your drugs will continue to be covered, because if they're not, they'll fill it for 1 month, and then you're on your own. So the drug coverage is probably the number one reason to do a regular review and make sure that you're okay. And then there's no surprises. You know what your cost is going to be on those drugs, really for the entire
Unless you
year.
add a new medication.
That's part of the evaluation, where we can literally let them know this is what you're, based on your current prescriptions, this will be your annual cost. This will be your monthly cost. This will be your cost if you hit the coverage gap, right?
And who doesn't need that information,
Good.
right?
Yeah.
And we have these tools at our fingertips. And if your prescriptions don't change throughout the year, we can roughly tell you the specific months you're going to be hitting your coverage gap. So at least now you can plan ahead and budget, okay, as of June, I'm going to pay paying more for my prescriptions.
Yep.
So, Brian, when you said a standalone drug plan, that is, that wouldn't be considered Medicare Advantage, because Medicare Advantage includes the drug plan within it. So when we're talking standalone drug plans, we're talking about people that are on Medicare and a supplement. So they're going to be seeing those premiums rise.
Yeah, so they have their Part B premium, that we've talked about, and then they'll have a separate premium for their supplemental plan, and then this additional premium for their Part D drug plan. And even amongst ourselves conversing earlier, it is shocking in many cases where a Medicare beneficiary will actually have better prescription drug coverage through their Medicare Advantage plan than what they get through a standalone Part D plan that they're
continues
paying.
to go up.
It continues
Yes.
to go up,
Yes.
exactly.
I mean, oftentimes half the cost,
Yeah.
if not more.
So it's super important for people to, I think that, HMO gets a bad rap. People like to say, oh, you don't want an HMO. It's different. It depends on who's taking care of you. And that's a huge part of managed care.
Correct.
Is selecting the right medical group to take care of you. Yeah, I'm sure there's groups out there that may not be doing what they should be doing, but I hope that we can all feel confident that Desert Oasis is doing what we can to take care of our members, and support them any way we can.
Correct.
We're not perfect, we have, we fall down sometimes, but we all are there to
There's
pick
always
up
growing
and
pains.
fix. There's, with change, we are changing. There's always some growing pains with change, but I think that it's a great option for people, especially when they're on a fixed income and they're able to get quality care at a good price that fits their budget. And when these plans continue to go up and up and up, at a time when their money's not going up and up,
right.
it really makes sense to look at these Medicare Advantage plans.
Well, and as things evolve, more and more people are used to being on HMO plans
Mm-hmm.
now. Most employer plans are HMO-based
Mm-hmm.
plans. You do have some options of PPOs, but more and more people are realizing the importance of managed care,
Mm-hmm.
having an entire team there to support you instead of you having to go around and figure out things on your own.
So when we talk about managed care, what exactly does managed care mean? What does that mean to you or mean to your clients?
So that means there's a team of
Mm-hmm.
professionals that are helping coordinate care,
Mm-hmm.
getting to the right specialist at the right time,
Mm-hmm.
getting to various clinics where they may have a need. And the burden doesn't completely fall on them to figure out which doctors to see or looking at the specialist. They have a whole team of them coordinating that care for them. And it's not just when they need a specialist, but it's preventive, it's being proactive.
Mm-hmm.
Um, Not only are the carrier plans given star ratings, but
Medical
I
group
understand that
also,
medical
yes.
groups get
Yeah.
star ratings too.
And Desert
And
Oasis has achieved a five-star medical
and
rating.
what
Yeah.
is that?
So
That means a lot to me and
yes,
for my
Right.
clients,
absolutely.
but what does
Mm-hmm.
that mean, a star rating for the medical group?
That means that we are taking care of the patients as we should be. We're making sure they're getting all the preventative care, all the preventative treatments. Um, I'm not really exactly sure what else we're rated on. Appointment times, how quickly patients can be seen, access to care, how long it takes for referrals to be processed. So all of those things, that maybe people that don't always think about when it comes to healthcare, but kind of behind the scenes things are, some of the things that we're rated on as a medical group. We also have won Best in the Desert for our immediate cares, which I'm super proud of. Our immediate care locations, throughout the Coachella Valley, Palm Springs, Palm Desert, Yucca Valley, and Indio. And we have just come leaps and bounds with those clinics. I hear patients talking about what great care and what great service they get at all of our immediate cares. So I'm super proud of that. And, it keeps people out of the emergency room. They're not
Hmm.
having to wait in the ER for hours and hours and hours to get the same type of care,
Yeah. Well, I mean,
which
I
is super
oftentimes
important.
hear from clients they prefer seeing the doctors at immediate care than
For
their own
sure.
primary care doctor. But that's obviously not what it's used for. But
Mm-hmm.
it's there when your doctor can't
Mm-hmm.
facilitate an appointment with you.
Exactly.
And it's very easy when our clients ask us, well, what urgent cares can I go to? And it's
Mm-hmm.
very easy to point
Yeah.
out all the Desert Oasis
Yep.
immediate care centers,
Well, good.
and that they get it. It's easy, and
Mm-hmm.
everything continues to get coordinated and managed. So all their records and everything is on the same page.
Yep, that's a
Yeah,
great point.
yeah.
And I was
Um,
just working with a client the other day, wanting to come back to Desert Oasis,
Mhm.
specifically because of the diabetes clinic.
mhm.
Can you tell us a little bit more about the diabetes clinic?
So I actually remember that call, Jeremy. The patient had called me. He was on a different insurance, and he had been on it for about a year. And I think it was through his employer. I'm not 100% sure, but he was able to come back to Desert Oasis Healthcare, and he was so happy to come back because of the diabetes clinic. And he said, since I've been away from it, I have not been, managed as properly. My medications aren't working for me as well. And I can't wait to get back to Desert Oasis Healthcare and back to the diabetes clinic so I can start feeling better. He was actually starting to feel ill from
Hmm.
not having his diabetes managed. And that's just one of the care teams that Desert Oasis has for our members. We have medication management. We have a whole cardiology team here at Desert Oasis Healthcare, our immediate care locations. Is that it? Okay. Okay.
The the medication management
Oh
team
my
has
gosh.
been a
We could talk about them
lifesaver.
for
Oh,
for days.
for
Yeah.
days,
Hmm.
with just the work that they do and helping people manage their medication costs. That's really
Hmm.
what
Mhm.
it's really about managing their out of pocket costs
Yep.
and finding discounts for them or finding alternative medications. One of you guys
Hmm.
talked about earlier. That team, that department, I mean,
Hmm.
they deserve all the kudos
Yeah.
because they really do an effective job. And for me too, you'd ask the question about what is managed care? I think, to put it simply stated, proactive care versus reactive care.
That's a great way to look at it. Absolutely.
And that's part of the star ratings too, isn't it? You
Exactly.
know, Medicare rewards providers and carriers or plans for keeping their members healthy. And so having that proactive, that's a great distinction, being proactive rather than reactive.
Yep.
A sick care system,
That's
Yes,
right.
versus a
exactly.
health care system.
Exactly.
Yeah.
Huh. That's a great way
And
to look at it.
there's even rewards programs you guys offer for people
Yep.
coming in for preventative care, all the different type of clinics of basically the rewards out there that
Yep,
people can get,
absolutely.
such
They
as
get
gift
rewarded
cards
with
and things like
actual
that.
dollars
Yeah.
for taking their medications, or they really are integrating a lot more.
With a preventive,
Incentive.
Yes,
and they come in and
they're
do their
really
wellness visit,
incentivizing
and
people
and
to be well.
yeah, and
Exactly.
members, our clients, are saying, "What? They're giving me what for doing what?"
Yeah.
For doing
My
what I'm
favorite is
supposed
the
to
one
be
For
where
going
they
and doing
they have
a
to take a
checkup,
picture of their
and
medicine, take a
Yes.
picture of
Yeah.
it, and then before they take it.
Yep.
yeah,
I mean,
They
they
get
I
a
just
remember
come
dollar.
up
I
with
got
all kinds of
a
things.
call from a client about that, and I had to call you. I was like, "Is
Yeah,
this
you
really
had to double
true?"
check it's true.
Melissa's like, "Yep,
How
that's
many
true."
times have you had that phone call?
Yeah.
did they go to the right office?
Yeah.
Is this a scam?
Yeah.
But
I'm like, wait a minute, George Jetson.
yeah,
So there's a lot to be said for managed care, and I love that you guys are on board and really helping promote Desert Oasis Healthcare. So we just talked about managed care and how people get the support that they need to help manage their care. What are some of the other things that people get on a managed care plan, Mark?
Well, so when you're on a original Medicare and a supplement, the supplement will only pay what Medicare covers. And so Medicare doesn't cover a lot of extras like dental, vision, hearing, sometimes over-the-counter items that are helpful to keep people healthy. Sometimes gym memberships and exercise programs to stay healthy. The whole point of the Medicare Advantage plans are to keep people healthy. And so they're looking at not just the medical aspects, but what are other social determinants that can help people improve their health. So there's a lot of other benefits that Advantage plans can cover that can't be covered on the supplements, because on the Advantage plans, Medicare pays the plan, and within guidelines, they're able to design the benefits, and they can include benefits that have those health determinants that aren't covered maybe by Medicare itself.
And it's crazy for me to think that Medicare wouldn't cover those types of things for people. So Medicare Advantage really does fill a gap, and help people with that type of care.
Correct.
But there's no additional cost for it.
Well, it depends. In our local area, there is an additional cost, or there isn't an additional cost in most of the plans. But luckily we're a very competitive environment down here. Other areas, plans that we have in our area are costing a lot more money.
Yeah. People are
But
very
people
lucky.
get that dental, the vision, the over-the-counter benefits, and as Marv talked, they look at not only physical health, they look at mental health, because it's an overall picture of everyone and keeping them healthy.
Dental health is an
Dental
important
health.
part of
It's
of,
so
of health,
important.
and vision and hearing. When it comes to
And-
dementia and Alzheimer's, hearing's really important.
Yes.
And even when it comes to vision on Medicare plans, it gets a little gray area there because vision is kind of two different things. There's an ophthalmologist, an optometrist.
Yep.
Well, when you're talking about vision plans in general, that's optometry with Medicare.
For your eyeglasses.
For your eyeglasses,
Yeah.
filling the prescriptions, getting your lenses, that type of thing. But most eye care, when it comes down to more important things, is actually covered under your medical portion. And that's always important for seniors to understand.
Yeah, for sure. People run into those issues a lot.
Yeah.
Yeah, and one of the benefits that a lot of clients recently have been talking about, actually it's not the clients, it's their family members, has been the PERS, the personal emergency response systems. I've fallen and I can't get up. If if somebody were to go out and purchase that system on their own, they're paying for the device, they're paying a fee for the installation, then they're paying a monthly, reoccurring fee for it. Whereas a lot of these Medicare Advantage plans, they include that as one of these extras, like Marv was talking about. And, from our perspective, we tell our clients, use it.
Yeah,
Like, we
absolutely.
want you to use these benefits because if the insurance company finds that there's low utilization, they don't have enough members using them, then they're gonna do away with
Possibly
those
take it
benefits
away.
and try to
Yeah.
find something else. And sometimes we have those clients that truly benefit so much from these
Yeah.
different programs, but if they're not being utilized or not being taken advantage of, they will go away.
And people do often say, how can they do this?
I know.
No monthly premium. I pay for Medicare and that's
Mhm.
all. How can they do this? And they kind of feel like, well, it's a scam or it can't be real.
Mhm.
But because Medicare is paying the plan directly, they pay for Medicare. Medicare pays the plan directly. And in the area that we live in, Southern California, the population is so large,
Yes.
they're getting paid for every patient enrolled with that plan.
Mhm.
And there's a lot, the numbers are huge. So in some of the more rural areas and outlying areas, they don't have as rich benefits,
Right.
as low out of pocket, maybe not as
Absolutely.
many extra benefits as we have here. People leave. We have a team of agents, and they're sometimes in other states, and they miss being
I've
here.
experienced that as well.
Very
Yeah,
low
people
out of
calling me,
pocket, all
"You're
these
not
great,
gonna believe
and
what I have to pay
Yeah.
here."
and
Yeah.
the reason they do that is to keep the members healthy. If they're doing all those things with their vitamins over the counter and the supplements or a walker or a lot of different things, even toothpaste,
Yeah.
sometimes and dental care, they're going to be healthier. They're going to be less expensive in the end for
Absolutely.
that insurance carrier.
So
Yeah.
it makes sense.
So it
Money
makes
well
sense for
spent.
them
Yep.
to encourage those members to use those extra benefits and not charge for those benefits.
And I often find myself reminding my clients that, when you talk about the monies that Medicare pays these plans, I say, remember when you were just started raising your family and you wanted to buy Johnny or Susie a new pair of shoes, but you look at your paycheck and you saw this thing called Medicare taxes coming out, right?
Right,
It's come
right.
to fruition. It's come full
You've
circle.
already paid.
There
Yes,
you go.
exactly.
That's right.
So, on top of, well, actually, one of the things that I wanted to mention about the extra benefits that the health plans offer, the Medicare Advantage HMO plans, or well, the Medicare Advantage in general, those are traditionally not managed by the medical group. Meaning, Desert Oasis Healthcare wouldn't be in charge of helping the patient with those parts of their plan. Is that correct? Is that that's how that works, right?
Yeah, so each of the individual carriers, they'll kind of subcontract out
Mm-hmm.
their dental through Liberty or Delta, or their vision through VSP or iMed. So they'll have their own vendors, their own specific networks. And I think when a Medicare beneficiary is reading through or sitting with one of us, one of the key terms that we say in terms of these types of benefits is routine. Like, to separate vision, your routine vision is for your general, check and for glasses and stuff, whereas you don't do that routine care with an ophthalmologist.
Mm-hmm.
So you have routine dental, routine vision, routine hearing, which is intended to indicate you don't need that referral through your primary care doctor.
Correct.
And part of that as well is understanding how to access those extra
Yeah,
benefits.
it can be a lot
and
of.
it's not through their primary doctor. It's not through the medical group. So some of the carriers will have like the very back cover of their enrollment guide. That's part of the onboarding that we do as a local agent, is help them identify who they contact and where they can get additional information or get that particular benefit.
So they make sure they're taking advantage of all those extra benefits
Yeah.
that they're being offered.
Right.
But sometimes it may
And
be a
then-
little bit more difficult
Yeah.
to
And then if you
access.
forget how to use them,
Yep.
that's where we're here year round.
That's right.
Mm-hmm.
Give us a call, tell us your problem, and we'll help find a solution for
Yeah.
you.
And I'm going to hit that home one more time. You guys are here year round to help the clients, to help people, not just here during open enrollment. And, people, I think it's such an not underutilized, but it's a great service that people really need to take advantage of. There's no charge for your services.
Mhm.
You guys are all paid by the health plans, and you're paid the same by the health plans.
Yeah.
Correct.
So there's no incentive to pick one plan over another.
Yeah.
So I think it's really important for people to seek out the services of a professional. I mean, it's important. Your health is important. So treat
And
it.
we're
with a
local
pride.
residents.
And you live here. You're
We're
part of the
in
community.
the community.
Yes.
This is all about relationships, and we see clients
At all of
at
the
an event
at
or in the
dinner.
grocery store
Yep,
or at dinner,
exactly.
and I'm just doing my best to remember who are you,
Yes.
and then it clicks.
My
Yes.
husband and I always have if I don't introduce within 5 seconds, he's like, "Oh, hi, I'm Raul. Nice to meet you."
That's so smart.
Yes,
I
it
love
is.
that.
That was an
But-
old
but
school
we love our
trick from one of the
clients,
doctors.
and we love our clients, all of us, and we
Yeah.
want to be there for them. So.
Well, I want to thank you all so much for joining me today. I feel like we could probably talk about Medicare Advantage and Medicare and benefits probably for another hour or two, but we're probably getting a little bit tired. Please reach out to any of these wonderful local agents if you need help with Medicare open enrollment from October 15th through December 7th. And again, thank you all, gentlemen, for joining me today, and thanks for being part of our community.
Great, thank
Thank
you.
you.
Thank you.
All right.